How are you, everybody? Dr. Rob here. Hope everybody's having a great day. We got a lot of questions post Facebook Live yesterday, podcast. It was great. A lot of engagement. Again, feel free. We do it every day, 1 o'clock Eastern time. We're usually on for anywhere from 20 to 25 minutes. Shout out. Let me know who's listening. Today, I won't be able to see who's listening. So let me know who's listening. Feel free to ask a question, comment, share it. Hey, Mike, how are you? So Mike Powell, everybody knows, Creator Chiropractic, Medford, Oregon. I got it right. Don't you love the way I say the state? And, we're having this great synergistic time here, both of us at home, trying to share information with everybody. And this is why we do this, so we can share the information. Obviously, the topic at hand is COVID-19. Can't get away from it. You turn the TV on, it's there, whether it's the news, movies, it's there. So again, every day there's something new. And there's epiphanies for a lot of my colleagues, a lot of the doctors. Don't think that everybody knew this before and everybody was an expert in the virus. People are scrambling, people are learning, new information's coming out, data is being released, studies every day are being released. So I have a whole team, a whole cadre, if you will, of people giving me information because they know that we're getting it out to you. Let me know that you're there. Ask a question, make a comment, share it, please. Share it with your friends. Just press the share button. That'll be great. Anybody else screaming out and letting us know they're there? Because there's a little bit of a delay today.
Yes, Steph is here, Frank Daniels.
Hey, Frank, how are you? How's things going? I caught your Instagram yesterday. Hi, Steph. How are you? I hope you're enjoying. Hola, ¿cómo está? Who else do we have? Okay, they're piling in. So, interesting, yesterday. Some new data that was released. Everybody knows that I'm in the epicenter. I live in Westchester. We're right outside New York City. New York is the hotbed. I don't have to go over the stats of New York versus everybody in the United States and New York versus their position in the world as far as COVID-19. However, there's been 4,700 deaths, not to be morbid, in this study. 86% of the people who died were those who had an underlying illness. Now, I want to make note of something, and I'm going to give you a good example in a moment. Not everybody knows that they have an underlying illness. People say, well, I didn't have that, and they haven't been to the doctor. They have high blood pressure. They have this. They have an immunoglobulin antibody problem. That's where we're going to go in a minute. So just because you don't know it doesn't mean you don't have it, so please don't be that cavalier. Having said that, 61% of the people who died, the percentage was men, 63% 70 or older, immune system isn't as strong, more comorbidities, etc. 7% were 49 or younger. The two leading illnesses that led to death in this study in New Yorkers were 55% had hypertension, which is high blood pressure, and 37% had what we call diabetes type 2. So clearly, most of the studies I'm seeing now, hypertension is a major issue. And I did head this by saying we're going to talk about gut health and we're going to get to it. But I alluded to these underlying conditions. I've referenced Chris Cuomo. He's done a great job on TV. As everybody knows, he's an anchor for CNN, and he has COVID-19, and he's really explained how bad it's been for him as a 49-year-old, very healthy or seemingly healthy individual who takes care of himself. He put his x-rays up yesterday, national TV, but he did reveal something that made it more obvious, leading to the fact of why he's feeling so lousy, if you will. So yesterday we talked about antibodies. He readily gave the information, so I'm not breaking any HIPAA, by him saying he has a low genetic, he doesn't know why, IgM. Those are your initial antibodies that fight off the virus at the time or the early time of infiltration. The first 7 days is viral replication. IgM is very high. It starts dropping at day 5, and then that IgG comes in. He has a genetically low IgM, so his own body defenses, even though he's tall, he's put together, he's a bright man, all that, wasn't able to hold off the viral replication. That's why it got in his lungs. He even said he knows that he has infiltration. He's typical when he gets sick, he gets bronchitis, respiratory issues. So part of the reason that it's so bad for him was because he had what we would call, I would believe it would be an underlying illness, but you wouldn't know it because he wouldn't put it down on a piece of paper. I've had some patients tell me that they've had it, some firemen, And I just want to reiterate, they said I could say what they had. So young guy, about 29 years old, he said no fever, a little bit of a cough for 2 weeks, and he's a pretty well put together young man. He was laying in bed. So it was 2 weeks where it was just like 2 weeks lost of his life. And he said that he had such body aches, believe it or not. And he did test positive, that putting on a shirt was a problem. The other firefighters who were a little heavier, a little older, said it was the worst flu they had, like 10 times the worst flu. So this is a beast, as a lot of people have described. So we're going to try and avoid it as much as we can. Some other interesting news before we get to the gut is that they did a study, an MIT professor did a study and found out that if you cough and sneeze, that it's maybe up to 27 feet that you could contaminate somebody. It's not the 6 feet if they're not coughing. And that's another reason why you want to wear a mask, because if you're wearing the mask, you're keeping it amongst yourself and really dimming what goes out. It's 27 feet because it's an air particle versus a thick, dense particle. It gets thinner and it evaporates in the air. 23 to 27 feet was the distancing. So do we have any more shout outs before we get into the good stuff in the gut? So I'm sure a lot of people checked in because they were wondering, what did I mean about gut? Well, a direct correlation between your gut health and a lot of the comorbidities with COVID-19. So let's look at it. When you have compromised gut health, like a leaky gut, and so let me explain to you what a leaky gut is. So many people have heard this conversation, but never really understood what it is. 80% of your immune cells are in your gut. We all know that. It's where your macro and micronutrients are absorbed. Your small intestine, which is sort of a misnomer, part of your gut, is 90 to 95% of the length of your whole gut tract. It is the thickness of a wet paper towel. When unraveled, has a surface area up to a basketball court. Its sole purpose is to allow food, nutrients, and vitamins to be filtered through and get to your bloodstream. When your gut becomes too leaky, there's holes in it or these gates open up, which we call tight junctions. Things that are in your gut pass into your bloodstream that aren't supposed to. Things like undigested large food particles, fungus, bacteria, and viruses. When they pass through, your body has an immune system, and we have an immune system that's supposed to come and kill it or fight it. And now the battle goes on. It's from the antigen, the foreign substance, and your own body. And that fight goes on. We have an innate immune system. We have something called an adaptive immune system, and they release these things called cytokines. So the worse onslaught of the virus, the more it replicates, the weaker an innate immune system is, the more things release out, more cytokines come out. And with all those cytokines come out, elevating to this, what we call in an epigrammatic manner, cytokine storm. So let's take a look at what a leaky gut or a damaged gut health, not taking care of our gut, can lead us to. Well, we know that if our gut is too permeable, we have too many toxins going to our liver. There have been some instances where there's liver implication in COVID-19. Also, gut to brain. Now what we're seeing is a very large amount of people that are starting to get tested have some sort of brain issues post-mortem with COVID-19. Interesting. Leaky gut and damage to your gut microbiota has also implicated many people in obesity, which is another comorbidity. In addition to that, we're also seeing diabetes, which is the number 2 comorbidity that's leading to those what we call underlying issues. The reason that you have an issue with diabetes is very simple, that the gut being permeable leads to too many inflammatory cells, and those inflammatory cells can damage the pancreas, and we lead it down a path of what we call type 2 diabetes. But more so than that, what I really wanted to talk about, which was stunning when we discussed it, was the gut to hypertension tie-in. So we did a lot of work, a lot of research, got a whole team looking at it, and I mean, we're talking 4 to 6 doctors last night working this to share this with you. There was a study relating the gut to hypertension. There were 41 patients in the study that had ideal blood pressure, 99 had hypertension, and 46 had pre-hypertension. The conclusion was the people with pre or hypertension had a reduction in the diversity of the bacteria in their gut. So the diversity, the good quality bacteria was a critical element not to hypertension, yet when the diversity was more towards the bad bacteria, if you will, that unleveling of good and bad bacteria, which we call dysbiosis, more people had pre-hypertension and hypertension. Then they doubled down what we call phase 2. The scientists in this study transplanted fecal matter from patients in germ-free mice. Yeah, there's a large growth towards what we call fecal transplants. The mice that received the fecal matter from the people with hypertension, in changing their bacteria, enabled the mice to also have hypertension. So they transformed it or transmitted it from human to mice. And we've seen in previous studies that when it goes back and forth, that you can get an outcome. And this outcome was obviously very damaging. So what we're saying is your gut bacteria can lead you down a path of hypertension. So I'm obviously going to talk about ways to take care of your gut. I'm going to emphasize overall gut health and why your gut is so critical. Another study with the gut to, if you will, hypertension was that conversely, the authors in this study transplanted feces from mice without hypertension into mice with hypertension. The conclusion was the mice with hypertension precipitously dropped and did not have hypertension anymore. So once again, we're backing up your gut bacteria, and what's going on in your gut is a critical element because your gut bacteria also depict signals, health signals, and also keeping your gut lining in an appropriate, healthy manner. And what's the big deal? What's the end result? Why is that bacteria so important? Well, the end all is what we call something that good bacteria can produce, which is short-chain fatty acids. The short-chain fatty acids of note is, without question, butyric acid. So there's a direct link in the short-chain fatty acids as that increased and a decrease in hypertension. So what increased short-chain fatty acid? Good diet, lack of sugar, no gluten, no dairy, like we talked about. Increasing dietary fiber. In addition, good gut bacteria, taking a probiotic, eating healthy, keeping your gut in a proper atmosphere, if you want, or an ecosystem environment, actually produced short-chain fatty acids. So the study really showed that bacterial populations, patients that had a higher blood pressure, had lower levels of good quality bacterial species that produced short-chain fatty acids. So everybody always knows that all health begins in the gut. Do you have the guts to be healthy? What have you done for your gut health lately? We've talked a lot about immune boosting, and you see it in the literature now. You're seeing it on TV. But ultimately, it does come back a major contributor. The major contributor is gut health. And if you keep your gut in a pristine condition, you're going to have better outcomes. And it also shows you're not going to develop these comorbidities that are so damaging when you contract, if you contract COVID-19. So I think we have a couple of questions.
No questions. Shanae says hi.
Hi, Shanae. How are you?
Marianne Callagher
Hey, Marianne.
says hi from Maine.
Hey, hi from Maine. I will love it. How you doing up there? You got any lobster for me? So the key component is, without question, your gut health, as we said earlier. So what do you do right now if you want to take care of gut health? Because I know I was talking to a couple of patients last night. They want to know what they could do. So let's start with diet. Let's talk about supplements, and let's talk about lifestyle. So diet. Again, I'm not really changing my tune on this. Whole food, good diet. Grass-fed beefs, wild fish, fruits and vegetables. The gut likes good quality fats. So ketogenic diet is a good choice as long as it's a clean keto versus a dirty keto. No processed food in it. That's a dirty keto. Take the processed food out, take that crappy sausage out, and you may have a clean keto. So diet is a critical element. I don't mind if you stick with a Mediterranean diet. Good diet, high fiber, lifestyle. One of the biggest things that is deleterious to the gut is stress. I get it. I've been cooped up here 3 weeks. It's been a great time. I get to talk to my wife all day, every day. I could see her rolling her eyes about now. But with that being said, I understand it. You know, again, I'm in the epicenter. I'm not somewhere else. A lot of my patients have said they've been positive. A lot of things are going on. I get it. But stress is a critical element. So obviously, those who are feeling the stress, yoga and meditation may be a great choice to keep you calm. If you have any problems, once again, in any of those things, feel free to reach out. You have all my contacts. I'm always, everybody knows if they reach out, I get back to you in a 12-hour period. Exercise. Exercise is great. Exercise is a critical element to the biodiversity of the gut. So everybody exercise, whether it be a walk outside, wear your mask, of course, whether it be burpees inside, whatever it is that you can do. There's so many downloadable exercise programs now. Everybody can implement them. I strongly suggest one of those. So you've got your diet, your stress reduction or your stress moderation, your exercise, and let's talk about supplements. What things would I recommend right now just to ensure, again, that pristine gut health where you keep everything tight and you're producing all the short-chain fatty acids? Good probiotic. So we carry a whole bunch of probiotics. Probiotics are a great choice. I love my liquid probiotics. I think that they're live, so you're going to get an immediate impact in the gut. In addition, love the spores. I'm a big proponent of Bacillus subtilis. I like it because it's an endospore. It goes through the gut. It gets to a desired destination. With the spores in the formula that we carry, the spore carries a prebiotic XOS. We've heard me talk about that. It's a great prebiotic to ensure that the probiotic stays live for its duration of its life. It also carries a bacteriophage. In addition, can't go wrong with vitamin D. There's actually vitamin D receptors in the gut. One of the biggest misses when we talk about vitamin D, D3, is we think it's just immune and musculoskeletal. It is. The bulk of that immunity and musculoskeletal performance and properties come from the fact that it imbues the gut with needed signaling to make sure that we have a nice health ecosystem environment. In addition, omega-3 fatty acids are a great choice. Love the omega-3s because they actually block unhealthy signals in the gut. With that being said, there's always a powder that we recommend, and powders are very handy now. You know, you don't want to go out shop all the time. You run a little low on food. You can make a little shake. A gut performing shake that has a lot of quality items in it is a great choice because each one of the formulas are a little different. One actually creates a microenvironment in the gut to decrease inflammation, and another one brings nutrients in that are needed to heal and seal the damage in the gut.
Veronica Hope says hi.
Hey Veronica, how are you? It's about 5 hours later where you are.
And chiropractic. Is hypertension that is controlled through medication still a risk factor?
Great question. So the question was, to repeat it, is hypertension that is controlled by medication still a risk factor? I asked a few medical doctors because I don't give any medical advice, and the answer to that, they all gave me a resounding yes. They gave me a yes. They all said, don't stop the medication. However, it is without question a risk factor. So you're going to have it with or without. And in some instances for this, they've said, again, I didn't tell you to stop it, and they say don't stop it. It may even double down on that risk factor.
Laura O'Hara Jackson, what is your take on IR sauna use or HBOT?
Yeah, I like the infrared sauna. I think that would be great to detox, get all the toxins out. Because remember, if your gut is leaky, you're going to give a whole bunch of extra toxins. 75% of the toxins from your gut get to your liver via your bloodstream. 25% get through the portal vein. You want to get rid of your toxins because the host, which is the only thing we can control, we want to take better care of. In addition, to help with the short-chain fatty acids, there are some products that actually have direct L-butyrate and fiber. We would put that in a shake in the morning. I take a fruits and greens shake, mix it up. Great choice. So if anybody needs anything, we'll add a link, and we're going to actually have that protocol by the end of the day on that link, so you can just press Dr. Rob's COVID-19 gut link.
Chiropractic says D is a pro-hormone.
D is a pro-hormone without question, and it shouldn't be called vitamin D. It should be called hormone D.
Veronica Hope, why is K2 important to D3 supplement?
Great question. Why is K2 important to a D3 supplement? First of all, we want to have D3, not D2. We're vertebrates and not plant. K2 ensures the fact that calcium floating in the bloodstream doesn't clot the arteries and doesn't cause stiffness. So I've had a lot of patients walk in that were just taking D3. D3 is great, but D3 on its own is probably a no bueno. D3 with K2 is the way to go. About 10 to 1 K2 to K1.
Shanae says she's finally getting back to workouts and loving it. Those feel good hormones. And she asks, how often should one detox?
How often should one detox? I think so. Just heard from a patient that may or may have not had it. We're not sure. I don't know if she was tested. She should take the antibody test. Hopefully, we'll discuss that with her later. She said that how often should you detox? If you've never detoxed before, I like a 15 to 30 day detox. If you've never detoxed before, bless you. So I like one large detox at the beginning. Right now, if you haven't detoxed, give us a call, reach out to us. I'll talk to you and I'll tell you how to detox while you're in the house on a low-level detox. It's a great question, and that's something that's probably, hey, Mike, we probably overlooked that. We should be talking a little bit about detox at this time. So that's a great choice. You want to detox your liver because you want all your systems functioning together. Remember that there was a quote that I've used, and there's a couple of webinars that I've titled in that. Here's the title. You can't control the virus, but you can control the host. So if we make the host inhospitable and as strong as we can, hopefully we can ward it off. Hopefully we can make the antibodies that we talked about yesterday. And hopefully, if we get it, the symptomology isn't so bad. Obviously, anywhere from mortality to almost no symptoms. 25% of people have no symptoms. Do we have any other? So I kept one in my back pocket, as you say. Another direct reason, and it's a little chiropractic, but it is substantiated by significant studies, is the idea of the gut effect on what we call the sympathetic nervous system. And that sympathetic nervous system is affected by what we call the vagus nerve. Now, the vagus nerve goes from the medulla oblongata down through the transverse colon. It is cranial nerve number 10. They call it the Great Wanderer because it covers so much terrain. It innervates so many different things. It is what we call a parasympathetic nerve. Parasympathetic means rest and digest, wine and dine. Sympathetic, fight or flight. So when you're sympathetic, guess what happens? Your blood pressure goes up. It has to, because it's like getting scared. The bear is in your house and going to attack you. So the vagus nerve, in many instances when you're sick or unhealthy, the tone gets decreased. So if your parasympathetic system gets decreased, your sympathetic system gets increased. That increase in the sympathetic system is an increase in blood pressure. So through low-level laser therapy and nutritional support, we've been able to modulate the sympathetic nervous system down, up-regulate the tone of the vagus nerve. So therefore you have, if you will, a kumbaya between these two alternating systems, and what we call your autonomic system runs in true balance. True balance leads to true health. So interesting, if you've know anybody who's got a violet light laser, it's a great choice. There are some nutritional supports that I recommend for the vagus nerve, and that the vagus nerve attaches to the transverse colon. The vagus nerve senses what goes on inside your gut. So it senses that bacteria, and it gets signals from inflammatory or non-inflammatory signalers, and then it really depicts what can go on from a here-to-here ratio, again, also affecting the blood pressure. I know you had some questions.
Chiropractic agrees that detox is a great question, and it's also an easier time to detox right now.
Great point. It is a very easy time to detox now because you're home. A lot of people think that if they detox, they're using the laboratory more. Not correct. It's not a colon cleanse. It is a detox. And another reason why it's so easy to detox now is because you have access to the food. You can make the shakes. You're not on the road. And you do want to follow a certain diet, which is the diet that we talked about. It's not the typical American diet, the standard American diet, which has a lot of processed food and sugars.
Veronica Hope, why magnesium threonate?
Why magnesium L-threonate? Now, she asked magnesium L-threonate. Magnesium L-threonate was studied by MIT. It was published in September of 2016. Magnesium L-threonate is great for brain health. I take it every night. It also helps me get some rest because I can use 5 or 6 hours sleep. The threonate was shown to decrease brain aging by 9 to 14 years and increase available magnesium in the brain by 50% and 15% in the spinal cord. Magnesium L-threonate is something I recommend for people who are concerned about any kind of brain development, any kind of brain loss, and those who may be pointed towards Alzheimer's. And one quick aside, since you asked the question, everybody can take that blood test to find out if they have what we call an APOE4 allele. So not to diverge, but the APOE4 allele will show you that you have a propendency towards Alzheimer's. Doesn't mean you're going to get it. You just have a genetic propendency towards it. You get one from mommy and one from daddy. So if you're APO4 in the bottom, but APO3 or 2 on top, you have a chance. If you're 4 and 4, you have a really good chance. So I would strongly suggest if anybody wants to know where to get the test, reach out, let me know. Don't forget about the antibodies. Those antibodies that we talked about are critical. Listen to what I said about Chris Cuomo not having IgM1. We're taking the antibody test. So for me, I want to know if I had it. I want to know if I had the antibodies. If I had the antibodies, which would be a good day because I felt pretty good other than my rib is out a little bit. One, I know that I was exposed. My immune system functioned well. Thank goodness. And 2, if it's somebody close to me in a family, I would offer some of my blood plasma. I'm saying that on my own. I would offer some of my blood plasma so they would get convalescent plasma, like my mom, who's going to be, my mom would be 91 in June. So I think she's going to be angry that I told her age, but, she doesn't even have an email, so nobody tell her. Do we have any other?
Greg Nelson, if I order the antibody test, do we send it in after the blood draw from the phlebotomist, or is it a self-contained test result?
You will, he said, if you can't draw your own blood, with most people can't, they will have a phlebotomist. Our phlebotomist is coming on Friday. We ordered the test Sunday. We got the vials. They're somewhere over here, but it's fine. We got the vials, but the phlebotomists are busy, so she comes Friday. We'll mail it out. We'll probably have, because of the weekend, we'll have an answer on Monday, Tuesday at the latest. It's a serum test. We're not using the blood spot yet. We may use the blood spot in a couple of weeks. We're waiting for more tests. We're waiting for this. We're waiting to be sure that we just don't want to rush it. We're making sure that the test is extraordinarily accurate and validated.
So it's not a self-contained test?
No, it's not a self-contained test. It's a serum. The phlebotomist has to come and get your serum. Do we have any others? Feel free to ask the questions. Do the shout-outs. We're getting a lot of good questions. I know Veronica's on. Veronica, tomorrow I'm doing a webinar at 8 o'clock my time on laser. So if you want to check in, that would be great. We're here every Monday through Friday at 1 o'clock in the afternoon. We usually hear from 1 to 1:30. Feel free to reach out, ask questions after. Again, share it. Thursday, I'm going to have the lead science officer from KBMO Diagnostics, and he's going to come in and really give you some of the history of the test, why this antibody test is so critical, and you'll see that they're starting to talk about this. As a matter of fact, there was an op-ed yesterday in one of the major periodicals, and they say antibodies for a passport. And in their mind, they said if people have the antibodies, they're willing to give them a passport to travel. It was their opinion, but it was an interesting take on how do we know? We don't care if you've had it. We only care if you can spread it. And the theory is that for a short period of time, the theory that you may not be able to recontract it in a day, a month, or a few months, etc. They haven't isolated that time frame yet.
Great chiropractic, great information.
Thanks, my friend. Thanks for the shout out. I appreciate it. We're good? All right. It's always a pleasure. I'd like to think today was very interesting. When I brought it up about the gut and the hypertension to a lot of my colleagues, it was an epiphany for all of them. We do have to still talk about the gut to lung, but I'm trying to save that for another day. Again, tomorrow I'm going to have on, I may do 2 Facebook Lives. I may do our typical one at 1 and do one a little later. And if I'm definitely going to have, I'll let you guys all know, I'm definitely going to have the science officer from KBMO, Dr. Brett, and he's going to do a great job, and feel free to ask questions. If you can't make it, or you can't make one of the 2 that I'm going to do tomorrow, send the questions in and we'll ask them and we'll do a Q&A. So without any further ado, it's been my pleasure. Hope to see you tomorrow, 1 o'clock. Dr. Rob, always yours in health.